I think it's really important to hear the perspective of a medical oncologist with the utility of the DCIS score. Joe, I often don't get an opportunity to talk with medical oncologists about the DCIS score. I'm really interested in your thoughts and perspective on that from the medical oncology point of view.
Sure. Well, of course, DCIS is a major public health problem. About 45,000 women in the U.S. Diagnosed each year with DCIS. And it's a direct function of screening mammography, because we essentially really didn't see DCIS before the advent of mammography. And we know that we're overtreating many women with DCIS, and even some women with invasive.
And there are papers coming out all the time accusing us of that, in effect, and so the DCIS score may be a really important ally in our decision-making process.
Well, actually, the DCIS score was, the development of the DCIS score, which we were involved with in ECOG in a collaboration with Genomic Health, was a direct response to a recommendation by an NIH consensus conference in 2009. And one of their key recommendations was to develop better tools for discriminating who required treatment. And so we took that call very seriously in the design and the development of the DCIS score and the validation of that score. We were fortunate in ECOG that we had specimens, archival specimens, from patients who were prospectively enrolled in a clinical trial of low-risk DCIS based on clinical pathologic features who were treated with local excision alone, and we had 10-year outcomes on those patients. So what we did was we then prospectively validated the DCIS score and found that in that group of patients who were selected by clinical criteria to have a low risk of recurrence, but still had about a 15 to 20% 10-year risk of recurrence, that we can identify about 70% of those patients who had a lower risk of recurrence that was about 10%, and about a third of them, about 30%, who had an intermediate or high DCIS score, had a risk of recurrence that was much higher. It was 25%.
Yep.
So we think that the value of the assay would be in the population in whom it was validated in. That is, those patients who have low-risk clinical features and who you're thinking about sparing radiation.
Right.
And the use of the assay in that setting can help people make a more informed decision.
Yeah, I agree with you completely. What about the radiation oncologists at your institution? What are their thoughts about all this? I mean, in effect, they're going to lose a bit of business here, but you and I both know we're probably over-treating with radiation therapy.
I don't think this is about losing business, because we already know that about 30% of patients with DCIS in the US who are treated with breast conservation surgery don't get radiation right now.
Right.
So this is about those 30%. It's about making a more informed decision for those 30%. Are you really making the right decision in sparing radiation in this patient population?
Okay. So therefore, the DCIS score really is an important adjunct then in our overall decision-making process.
I think so, again, especially for that group of patients in who you're thinking of sparing radiation. There will be additional validation studies that are being done as we speak that I think will hopefully replicate what we found, and also determine what the relative value of radiation in individuals who have a low, intermediate, or high DCIS score.
Right. Joe, do you have any final thoughts about the DCIS score?
Well, the NCCN guidelines actually, I think, are worth reviewing, because they do call for radiation as the standard that is supported by level 1 evidence, but they also indicate that sparing radiation would be an option for some patients with low-risk features. And the level of evidence is not as great, but it's there, and it's being done in the US. So I think the DCIS score can really help in that population make clinicians make a more informed decision about whether that's the right choice.
Well, I think this has really been an excellent discussion about the value of the DCIS score. I really appreciate having the perspective of a medical oncologist on this very subject.